In order to be a responsible adult, you need to get some health screenings. There are all kinds of guidelines and recommendations. It can get a little overwhelming. Today, we're going to talk about just 5 tests I think are worth putting into your already packed schedule over the next few months or years. If you make the effort to look for trouble brewing beneath the surface while you still feel fine, you'll have time to prevent a worrisome diagnosis and make some little changes now that will end up changing your future in a really big way. You're listening to the Health Courage Collective podcast, episode 265, 5 important screening tests for midlife. Welcome to the Health Courage Collective podcast, the show for women who want to be in the minority of people who feel healthy, strong, and more alive in their 70s, 80s, and beyond, and know that the most crucial time to shift their probabilities is right now, the years right around the time of menopause. Being in the know gets you elite level care and results without the elite price tag. I'm so happy you're here. Hello, and welcome to today's episode. I hope that you are doing so great. How's your appreciation of Shakespeare? I hope it was insightful for you to realize and ponder on the fact that logic is not the same thing as intelligence. It's only one piece. And in order to get to age 80 and vastly different health status than most people, you'll need to be more than just half intelligent. You'll need to be able to act smart with little to no information, which is where thinking in story shines. Today, we're going to talk about screening tests that can help you see whether you're on track to avoid or drastically delay the common diseases of aging that make most people stop living before they die. A few weeks ago, we talked at long length about breast cancer screening via mammograms. You can go back and listen to episode 258 if you want to know more about the benefits and limitations of mammograms as a screening tool for the general population. I think it's an important thing to think through and make an informed choice for yourself. Screening for breast cancer risk is a prudent thing to do, but I think there are better options than mammograms for the general population. That prompted me to look more into colonoscopies and how helpful those are for screening the general population, given the risks of anesthesia and internal bleeding and perforation. You can listen to episode 262 for all of the details there. But what about other screening tests? I think it's useful to get a friendly reminder about what screening tests are most likely to improve your future. But I also feel like it's not especially helpful to get an enormous catalog of tests listed off in your ear while you're trying to weed your garden or wax your car or whatever. So I'm going to try to do my best to let you know of tests that I think will help you age at a more elite level, but do it from an organized perspective that gives it all kind of a framework. We'll see how it goes. I hope it helps you to not have to stop living before you die. First off, let's start off with the definition of a screening test. According to Johns Hopkins, it's a preliminary assessment designed to identify individuals who are likely to have a specific disease or condition before any symptoms appear. Its primary goal is early detection to allow for earlier and more effective intervention. There are bajillions of tests you could get before any symptoms appear in an effort to intervene before your life is negatively affected. And the perpetual debate about whether screening tests are useful is always between, is it useful for an individual person or for the general population? Should the general population all be screened with a whole body MRI? Clearly not. The risks outweigh the benefits and the costs would be astronomical. But an individual person might want to fork out the cash even though they understand the shortcomings of finding several potential problems and having to follow up on all of them and still decide to do it anyway. And there are tons of helpful tests that aren't to screen for a specific disease, but the probability of developing disease in general, which is mostly what we're going to talk about today. So most of them don't fit the definition of what a technical screening test would be called, but I think they're useful for you. I think for a woman in her 40s or 50s or 60s who doesn't want to have to stop living before she dies, the way she's seen so many others do, there are some useful tests that can clue her into opportunities to change the trajectory of her wellness. That's a big deal. Little abnormal changes now, like learning to keep your blood glucose within certain numbers even though you're not diabetic yet, can result in huge changes later, like avoiding a heart attack or a cancer diagnosis or dementia, or all three. I know I say this all the time, but when you get a test of some kind, you don't want to be normal. Normal is very possibly not good, especially in tests that compare you to an average of people. You don't want to be like an average person. The average person stops living 15 to 20 years before they die. The average American takes 5 medications and has 3 chronic diseases and loses their independence by age 78. You want to be optimal, so make sure you understand what values you actually want to aim for. And it's okay if you're not there yet. The Harvard longitudinal study that has been studying what makes us live well for over 85 years now, so far shows that the biggest thing you can do for your long-term health is to be conscientious. Doing your best to learn what is good for you and then actually doing it, even though it's hard, is extremely effective, even if recommendations change over the years, as they always seem to do. That and maintaining good relationships, those are the keys. So let's talk about the top 5 tests I think will help a conscientious woman like you sidestep some potentially major problems down the road. And these are not all things you need to go do tomorrow. Keep them on your radar as ways you can gather information to make changes that will really tip the odds in your favor, and maybe just put reminders in your calendar over the next few months or years to schedule them and get them done. Just being aware of where you are and making little changes now can make a big difference, especially if you maintain those little changes for years to come. It's always useful to stratify all of the things that could kill you or make you stop living before you die in terms of likelihood based on statistics. And your personal likelihood, which I don't know, but you would. You're an individual that likely has unique advantages and challenges, but for the general population, the number one threat to your long-term health, in my opinion, is metabolic dysfunction. How well your body is able to process and produce energy from food. It affects every aspect of your health and drastically increases your risk for all of the chronic diseases of aging. All of them. Everything you can think of or have watched loved ones have to manage and suffer with as they get older is exacerbated by metabolic trouble. I love what Dr. Casey Means calls it, bad energy. She has a whole book called Bad Energy. It's fabulous. I highly recommend it. So my first recommendation that I think will help you, possibly more than anything else, is to understand how your body handles glucose. The easiest way to do that is to have your hemoglobin A1C checked next time you get your blood drawn. It's a good thing to do, but it doesn't tell you the whole story or really teach you very well. The most effective teacher you can have is a continuous glucose monitor. Wear one for 2 months or so, and you will learn so much about what food is doing to your long-term health, which foods help keep your blood sugar steady, what things spike it, how your behavior and mental stress affects your blood sugar levels, and more. There's something about seeing the numbers for yourself when you go to bed earlier or take a short walk after lunch and tweaking and experimenting that is 1,000 times better than listening to someone else tell you some good ideas. It's experiential learning at its best. I'm sure you've seen people wearing continuous glucose monitors before. They're a little sensor that usually you put on the back of your arm. Another less common blood test that can be useful if you can get one with your set of labs is your fasting insulin level. As important as blood glucose numbers are, your insulin numbers are even more important, but harder to get. So we use blood glucose as a bit of a proxy until we can more easily measure insulin levels. You can get a prescription from your doctor for a continuous glucose monitor, which you'll have to pay out of pocket for, or there are some places online that you can get them. I'll put some links in the show notes. You can expect to pay about $100 each for them, and they last for 10 to 15 days each, depending on which brand you get. I've used Freestyle Libre off and on for a few years, and I love that one, but I'm sure the other ones are good too. We can talk more about how to interpret the data some other time if you want to. Remember though, you want to be optimal, not normal. Normal is not good enough, especially for blood glucose numbers. The second test that I think everyone should get that will give you a good idea of your readiness to avoid the chronic diseases of aging is a DEXA scan. I get one every year, and I think that you should too. It's kind of life-changing. We can go in depth about how to read the results of your DEXA scan some other time if you want to. Send me a message at healthcouragecollective@gmail.com. I would love to do that. It's totally something you can understand on your own. For the test, you lie down on a padded table for about 7 minutes and a machine arm runs over you. It's not claustrophobic. It does emit a small amount of radiation, about 400 times less than a 2D mammogram, and about 800 times less than a 3D mammogram. It's about equivalent to the amount of background radiation you get from living on the earth for 3 hours in normal life. Your DEXA scan will tell you your bone density, muscle mass in each segment of your body fat in each segment of your body, and how much visceral fat you have. These are all critically important because if you want to stay independent, you need strong bones and strong muscles. The best time to intervene if you find out that your bone density is low is yesterday. You do not want to put it off till you have osteoporosis. The stronger your bones can be right now, the better. If you don't want to have to stop living before you die, the biggest asset you need to bring with you into your 60s, 70s, and 80s is as much muscle mass as possible, besides maybe an optimally functioning brain. But being under-muscled is way more risky than being over fat. So knowing your muscle mass and seeing it in segments is very helpful in formulating a plan to have the most awesome life possible. Subcutaneous fat tells you about how much energy you consume versus how much you burn, and it's kind of important, but not as important as bone density or muscle mass or visceral fat. You can be healthy with more subcutaneous fat than you might like to see, but visceral fat is metabolically active in a big bad way, so the less you have or the earlier you can find out that you have too much and change that, the better off you'll be in the long run. The third test I think you should consider getting is kind of a big ask. It's a little unpleasant, but not as bad as a colonoscopy or a mammogram, so maybe it's not that big of a deal after all. This will be something you'll probably want to do a little more research about and consider getting in the next couple of years, but it's the number one test correlated with all-cause mortality or dying for any reason. You're much more likely to die for any reason if you have a low VO2 max, and much more likely to stay alive for all reasons if you have a high VO2 max. If you'd like to hear more about the ins and outs of how a VO2 max test works, what it measures, and how it's done, send me a message at healthcouragecollective@gmail.com. The short answer is that it's a measure of your cardiorespiratory fitness that's done by either running on a treadmill or riding a stationary bike with a big mask on your face to measure how much oxygen you inhale and exhale and how much carbon dioxide you exhale. Your VO2 max measurement is a measure of the maximum amount of oxygen in milliliters your body can utilize in 1 minute per kilogram of your body weight. Your VO2 max can tell you a lot about your risk of dying for any reason in the next 10 years, and it could be extrapolated to understand your risk of having to stop living from any cause in the next 10 years, which is my way of saying you're not dead, but you aren't able to do the things that make you feel alive anymore. You can get into the nuance of reading your VO2 max results once you decide to go get the test. But just know that while any improvement is absolutely fantastic, getting from below average to above average on your VO2 max test will unequivocally change your life and your future. If you go from low to above average, you'll reduce your risk of dying from any cause by 70%. That's enormous. And with a little consistency, it's totally achievable. It's probably the biggest thing you can do for your long-term health. And a VO2 max result is just a way for you to quantify where you are and the progress that you make with your plan. I've done a VO2 max test before. I expected to not enjoy myself, which I think helped because it really wasn't that bad. Just like doing a few minutes of hard cardio with a big mask strapped to your face. You'll look like Bane from the DC movies, which I've never seen, but I know what Bane looks like. I'd rather do a VO2 max 20 times than get a colonoscopy or a mammogram. And it gives you numbers to motivate you as you improve, which I find very useful. There is also a home VO2 Max mask you can buy that is quite accurate, so you can measure for yourself all the time at home, which could be cool, except for that it's like $7,000. So if you're into that, go for it, but mostly just elite athletes buy those. One of the ideas that always kicks around my brain is that it would be so fun to have a mastermind where we could buy several helpful gadgets like this and share them amongst ourselves, kind of like checking them out from the library. Maybe someday. It would be awesome. I have a long list of toys that I would want to buy and share with all of you, and I think it could be super cool. As you're thinking about screening for problems in the making, it's useful to always keep in mind what is most likely to kill you or make you stop living before you die. Number 1 is metabolic dysfunction, which we already talked about. Continuous glucose monitor, DEXA scan, and to a certain extent VO2 max give you information about your metabolic health. Sort of kind of number 2 is immune system decline. We don't have a great way to test for this, but both your ability to process glucose to create energy and your ability to respond to threats appropriately, but not too overexuberantly, affect and drive forward or put the brakes on all of the other chronic diseases of aging. All of them. You could get a high-sensitivity C-reactive protein test with your next blood draw to check your total body inflammation. That's better than nothing, but certainly not a comprehensive assessment of your immune system health. The statistically most likely thing to kill you is cardiovascular disease. Heart attack, stroke, heart failure, coronary artery disease, peripheral vascular disease. Your VO2 max is highly correlated to your cardiovascular health, so that's useful there. But it's possible you could have good cardiorespiratory fitness and still have one or both of the other biggest risks to your heart: high blood pressure and suboptimal cholesterol. Your lifetime exposure to high blood pressure is a big deal here. So the longer the pressure in your blood vessels is too high, the more wear and tear on your cardiovascular system, and the more likely you are to have a cardiovascular event. This is why blood pressure that's only a little bit high is a big deal when you're young, like less than 60. The more heartbeats you accumulate when the pressure is high, the more damage you accumulate in your vessels, and the more you're preventing your body from being able to thrive in the future. So blood pressure is a good old-fashioned bread and butter screening test that really matters. Another good risk assessment for cardiovascular disease is getting your blood tested and understanding what those cholesterol numbers actually mean. I don't put a lot of stock into just total cholesterol and LDL cholesterol numbers. You need more complete information. But there are things that can give you a better idea of your coronary artery risk. Dive into learning about those to be able to drastically lower your risk of cardiovascular events. We talked about some of them in episode 171, so that's a good one to go back and listen to. You want to know your HDL, your triglycerides, your triglyceride to HDL ratio, which you can figure out on your own based on those two numbers, whether you have Lp(a), and your ApoB numbers. High sensitivity C-reactive protein that we talked about earlier is also a good indicator of your cardiovascular risk. We're going to talk more about some little understood things about cholesterol in a couple weeks too. Another cardiovascular risk assessment is a coronary calcium score. It's just what it sounds like it would be: a scan to see if you have any calcified plaque in your coronary arteries. It's useful to know if you have stable calcified plaque in your arteries, but probably not as useful as knowing that you have dangerous, unstable plaque. But it's what we've got. It exposes you to a small amount of radiation, so that's something to take into account when deciding if it's worth it to you to get the test done. It's not a routine screening test, more like something to do 0 to 3 times total in your entire life or something. The Google AI overview says, quote, "Insurance rarely covers a coronary calcium scan as it is classified as a preventative screening." Heaven forbid insurance pay to prevent a common and deadly event, but it usually costs around $120 or so out of pocket. And don't forget the easiest, cheapest, most obvious cardiovascular risk assessment, your blood pressure. You can pretty easily find information about what appropriate blood pressure numbers are and how to measure it, etc. It's a fundamental for a reason, and you shouldn't be spending your attention or time or money attempting to upgrade any more obscure part of your health if your blood pressure is not optimal. It would be like spending a whole day and a lot of money on getting the stitching on your steering wheel perfected while your brake pads are completely rusted through. I'm all for fun and obscure things like shining low-level lasers in your ears or whatever, but please make sure you don't get your priorities backward. The amount of time your blood vessels are exposed to higher than optimal pressure adds up to more and more vascular wear and tear over time. And automatic blood pressure monitors are cheap and easy, like Lindsay Lohan. After cardiovascular disease, cancer is the statistically next most likely thing to kill you. We've talked at length about colonoscopies in episode 262 and mammograms in episode 258. Screening for colorectal and breast cancer is extremely important. Not smoking is important to reduce your risk of lung cancer, as maybe mitigating radon gas from your house if needed. Have good breast self-awareness and notice any changes. Screen for cancers that you can screen for, mostly colorectal cancer, breast cancer. I just did my ARIA tears test and found it to be useful. And also PAP tests, and have good skin self-awareness and go to a dermatologist if you are concerned about your skin or skin cancer risk for any reason. The last major category of diseases statistically most likely to shorten your health span are neurodegenerative diseases, mainly dementia like Alzheimer's, but also other types of dementia, and Parkinson's and Huntington's diseases. There aren't good specific screening tests for these. Well, there are tests like the mini mental status exam, but you'd have to be pretty far down the dementia path for that. It's not an early risk assessment. You could get a genetic test for Huntington's, Parkinson's, and to see if you carry the ApoE4 gene that increases your chances of getting Alzheimer's. These could all be things that you might want to do if you feel that you're at high risk or you have a certain family history for one of these conditions. But for general preventative screening for everyone, our total body inflammation measured by our C-reactive protein, metabolic health as seen with continuous glucose monitor, and DEXA scan, and your VO2 max will tell you a ton about long-term threats to your brain. We already talked about losing your independence due to frailty of bones or muscles, so I won't keep harping on it, but this is another potential thief of your life force that it's so worth fighting for and easy to screen for now with a DEXA scan. Don't wait to start checking or working on your muscle and bone strength till you've become a walking calamity, unsafe to move about the world on your own. One of the biggest predictors of a good health span is having close relationships. I don't know of a good screening test for this, but it is worth spending some time thinking about your personal relationships. You don't need a lot of friends, but you do need a couple of good ones. So take stock of your relationships and make a plan to work on improving them if needed. It's probably as good for your long-term health as maintaining plaque-free arteries and cold plunging in your buddy's broken down hot tub with dead bugs floating on the surface. A brief list of some other screening tests that I believe indicate your ability to live more as you get older rather than less are your grip strength, your toe strength, your balance, your flexibility, your hormone levels, regular eye exams, that's a big one with lots to screen for, and a few other blood tests like cystatin C to measure your kidney function, LFTs to measure your liver function, nutrient levels, and possibly toxin exposure levels. Thank you so much for being here today and caring about doing something now to prevent or drastically delay some of the most common conditions that could reduce your ability to be a force for good in the world in the future. I want my kids to live in a future where you are at your best. I think these 5 screening tests that we talked about today will improve your odds of living with fewer chronic diseases than is normal. First, wearing a continuous glucose monitor for at least a month or 2. Second, getting a DEXA scan. Third, testing your VO2 max. Fourth, getting an intelligent cholesterol test with values that actually indicate your real cardiovascular risk. This is in addition to checking your blood pressure regularly, which you should be doing. And fifth, screening for the cancers that have screening tests available, which are colorectal cancer, breast cancer, cervical cancer, and skin cancer. If you were to do these tests at the appropriate intervals and make any changes necessary to improve the results, you'll have a very well-deserved unfair advantage over most people as you age, which will give you more options to live and give more as you get older rather than less. Next week, we're going to talk about why you can't sleep. Until then, catch problems before they become a problem, and don't be normal. Thank you so much for showing up for yourself today and caring about how powerfully you're able to show up for the world 20 or 30 years from now. If you found this episode helpful, it would mean the world to me if you share it with a friend and also subscribe to future episodes. The more smart women like you we can have in this community together, the more we can lift and strengthen one another. This podcast is for entertainment and information purposes only. Statements and views on this podcast are not medical advice. This podcast, including Christina Hackett and producers, disclaim responsibility for any possible adverse effects caused by the use of information contained herein. If you think you have a medical problem, consult a licensed physician.